안녕하세요. NI필치과 원장 임필입니다.
Greetings. I am Dr. Impir of LIMPIL Dental Clinic. I am honored to be here as Master Course Basic Director. Prior to offline Master Course, albeit in a short time, I'm going to address a part of the Master Course with you today. Today, I'm going to talk about implant placement using guides. I'm going to talk about the basics of the said contents. Let's take a look. Let me show you a clinical case first. On the left, in the lower anterior, implant has been placed like this. This was actually my case. We frequently see cases where the implant invades space of adjacent tooth. If you have been placing implants the analog way for a long time, I'm sure you have at least once experienced a situation where the implant touches upon the adjacent tooth's root. I have experienced myself. If you do not check the root and just look at the crown and do implant placement, in fell swoop, you can get this kind of situation. You can see the root of adjacent teeth is slightly tilted when you place implant. You need to look at the form, angle, and position of adjacent to root. I've adjusted the position and have placed the implant again in appropriate position. This is the case where I've used OneGuide from OSSTEM to place the implant. Using digital dentistry, CT was utilized. CT guided implant surgery is being frequently done. In the lower, there are 3 missing teeth. In order to place implants, guide was fabricated ahead. Using this guide, implants can be placed in the desired position, and prostheses were delivered. If you look at X-ray image, in the lower, in order to place 3 teeth in the lower, guide was used and implants were placed in appropriate positions. I want to talk about clinical situations where implants have been placed in less than ideal positions. Getting right implant position is very important. If you cannot get ideal implant position, let's look at different situations. First, ideal situation in the lower first molar area, the implant position should be determined considering the crown form and position, and in the center of it, implant should go in. Then ideal results can occur. But, as shown on the image, if the implant has been placed tilted towards the side, implant itself can be placed successfully, but what is important is that in the prosthodontic phase, you may not be able to deliver ideal prosthesis. If you determine the implanted position considering the form and position of the prosthesis, you'll be able to get better results. The prosthesis we get if the implant is placed in less than ideal position would also be not favorable. So let's look at ideal implant placement. Second, placement angle. When planning to place an implant in the mandibular region, ideally the implant angle should be towards the long axis of the opposing tooth. It should be towards functional cusp or long axis. You can get good results if the axes are aligned. If the implant placement position is slightly deviated and if the implant is placed as shown in blue, you may be able to get osseointegration and proceed with surgery, but if you think of the final prosthesis, compared with this implant, the prosthesis would be less than ideal because the implant placement angle is deviated and loading will also occur in this angle as well. So this is an inappropriate position. Implant angle is important, but implant placement depth is even more important. If I am to place an implant in the missing first molar area, you need to consider the implant placement depth. You need to design the final prosthesis first. Considering that crown, you need to determine the implant placement depth. This is a must. As shown on right, if you think of the distance with the opposing tooth, if you can get sufficient clearance of over 9 mm, the prosthesis thickness would be about 2 mm and abutment height would be over 4 mm. Gingival height length would be about 3 mm. If we assume such, the implant should be placed here. We need to calculate this in a reversed method. What I'm continuing to emphasize is that in implant surgery, we need to think of top-down approach. We need to think of the final prosthesis first, and based on that image, you need to find the implant placement position that fits the criteria. We need to perform restoration-driven placement or top-down concept. If you just look at the residual bone and place the implant in the residual bone, after that, if you try to fit the right prosthesis, then it can become very difficult. Therefore, before going into implant surgery, you need to think of the final prosthesis image first, and you need to think of where you need to place the implant to get that prosthesis. Such treatment planning is necessary. If there's lack of clearance with the antagonist, as shown here, there are different gingival height options available. Therefore, you can use one that is smaller. You can get prosthesis and complete the case. But in the case where the clearance is insufficient, if you place the implant shallow as shown here, with time, it will invade the biologic width, leading to additional bone resorption. If biologic width is not respected, it can lead to bone resorption. Before going into surgery, you need to choose the implant position appropriately and perform implant placement. In general, when placing implant, drilling is used. Since long ago, I've used the analog method to place implants using surgical stent. I fabricated surgical stents and placed implants, but it does have limitations. It's not fully accurate. You need to get more used to it, and with surgical experience, then a surgeon tends to just place the implant based on experience and technique. However, no matter how much experience one has, if one's hand is slightly deviated, then there can be significant difference in terms of implant placement angle. Placing implant using the surgeon's tactile sense can result in good outcomes. However, it is difficult to say that it can produce consistent outcomes. As we all know, the analog method compared with guided surgery has less accuracy and there's higher risk. On the other hand, if you use guide to place implant, you can get better accuracy and lower risk. Therefore, you can get more appropriate implant surgical results. When you use the guide, let's look at how digital guide has developed. In the past, we used to place implants freehand. This is not digital guide, but the surgical stent made with analog method was used for implant surgery. An image is going to be shown later, and positioning guide kit and smart guide kit, which is not as elaborate as CT guide kit, were used at some point. Ultimately, digital guide using CT information such as OneGuide was introduced. So digital guide has developed as shown. If you look over here, the implant is being placed freehand and it depends a lot on the surgeon's skill. Yes, it is true that there are doubts as to whether the dentist with absolutely no implant placement experience will be able to place implant 100% appropriately using digital guide. That can be tough. However, once you know how to open flap and differentiate the different bone qualities and understand the different implanted drilling procedures, then naturally you come to rely on digital guides to get the appropriate path. This image shows how stent was used in the analog days for implant surgery. When surgical stent using the analog method were used, first the patient impression was taken and then model was made, followed by diagnostic wax-up. After diagnostic wax-up, the model would be replicated and using tools like OmniBac, stent was fabricated using such sheets. The stent would be inserted during surgery and using the stent, implanted drilling was performed. However, there were limitations in the surgical stent made with analog methods. The position of this, even if the positions were set accurately, there were many difficulties in using the analog stent. Insertion and usage during surgery was tough because, unlike patient's gingiva and bone, the model had very consistent surface. As a result, if drilling path deviated due to irregular bone or gingiva, then implant placement would proceed different than expected. Although we have used the analog surgical stents, we no longer use it because of these limitations. This is positioning guide kit and smart guide kit. Let's take a look at them briefly. On the left is Positioning Guide Kit, and on the right is Smart Guide Kit. This is OneGuide system which uses digital dentistry, which is very popular these days. On the top left, this is an image of Positioning Guide Kit, and the image below is Smart Guide Kit. And on the right is OneGuide Kit. Let's take a closer look at each guide kit. This is the Positioning Guide Kit, and as shown in the image, there is a circular tool which is used to find the position. If you take a look at the image, there's different diameters, 5mm, 6mm, 7mm, and 8mm. Using the circular wheel, positions were determined. These kits were extremely useful in getting the right path and getting the right mesiodistal distance. Implant placement depths cannot be managed with this kit. However, roughly, the inter-implant distance and implant to natural tooth distance can be managed adequately using this simple kit. If you place the implant freehand without guide kit, on the panoramic image, it may look as if implant has been placed appropriately, but if you look at occlusal view, one is placed like this and the other like this. When you connect the final prosthesis, it will be a problem. In surgical stage, it's not a problem, but when delivering final prosthesis, because the relation between the two implants are not appropriate, there can be many difficulties in prosthodontic phase. In order to place the implant in ideal positions, when using the tools in these kits, it can be done much easier. Rather than having a tilted angle, you can place it accurately. Wheel is used to find the position, and following that position, drilling is done to place the implant. Smart Guide Kit. This does not rely on CT information, but by fabricating guide like this, as mentioned previously, the same method is done. This is more detailed. On the model, you can fabricate this kit. After taking impression, on the plaster model, you can find the position. Drilling is done and pin can be inserted. If you put it in hot water for a minute, you can form a guide made of resin. Using the guide, you can use it for drilling upon surgery. You can do this not just by using the model, but also you can make it in patient's oral cavity. And you can use this guide to place the implant. Compared with other guide kits, the Smart Guide Kit has sleeve, and therefore, with sufficient sleeve length, you can get more stable path. If you look at the procedure once again, using the model, guide can be fabricated, and this can be fabricated within patient's oral cavity. Once guide is fabricated, you can use it during surgery to get appropriate drilling. Such guides are very prone to heat and high pressure. Therefore, if they are placed in autoclave, which exerts high temperature and high pressure, there's danger of deformation. So for disinfection, you need to put it in 70% alcohol for 15 minutes. Finally, this is OneGuide Kit. This is CT information based. You can get better positions. To do this, you can use OneGuide Kit. In order to use OneGuide Kit, what is important is patient's CT data and patient's oral information. By combining the two information, we can fabricate guide and use it upon surgery. If there's no scanner in your dental clinic, you can take impression and using the impression model or send the impression to digital center. Model can be fabricated, model scanning can be done to fabricate guide. Using this workflow, guide can be fabricated. When you place implant freehand, as you do drilling, you only rely on your tactile sense. Smallest mistakes can lead to catastrophe in terms of implant path. If we use guide, we can minimize such risk. This is not just relying upon your tactile sense, but you can get more consistent surgical results. If you look at the characteristics of OneGuide Kit, the thickness of OneGuide is thin. The gap between drill guide and template is 0.05 millimeter each, so 0.1 millimeter in total to minimize resulting error. There are different drills and tools within the kit. To take a brief look, if the bone is soft, you can use the two options here. And if the bone is normal bone or hard bone, you can use 3 drills to place the implant. Another characteristic is that in OneGuide Kit, there is open sleeve and closed sleeve. In the case of lower number 7, if we need to place implant in the most distal tooth, it will be difficult for the patient to open mouth when a guide is inserted. Therefore, before surgery, you can order a guide with open sides. And when you put in the drill, it goes in not from the occlusal surface, but it can go in from the side. Therefore, drilling can be done more easily. Also, there's no metal sleeve compared with the guide system of other companies. Because there's no metal sleeve, you can get more precise and stable implant placement. If you take a look at the procedure, CT data and oral scan data are merged to fabricate the guide, and using that guide, if drilling is done, we can do top-down approach in doing implant placement. We can do restoration-driven placement. This is the overall view of the kit. If you use OneGuide Kit, you'll be able to get ideal implant prosthesis position. And you can do this more easily. Today we've looked at surgical guides, and as for specifics, you can study that with me in an offline course. Thank you for watching.